All right, thanks, Corey. We're joined with Dr. Rollins once again, and we are going to be discussing those health headlines that Corey just discussed. A lot of new studies on cancer, so that's really what we'll be talking about today.
Yeah, and living in Colorado, we're the #1 state for skin cancer, so this is a very near and dear issue to us. I thought that was an interesting study on the nail salons with the ultraviolet lights, and for you folks who go to nail salons, looking at that study, just so you know, it's not a whole lot more ultraviolet light than you get with your hands on the steering wheel for a while, so I wouldn't suggest running away from nail salons necessarily. Sure. But we get baked with ultraviolet rays here in Colorado because of the high altitude. And so I want to talk a little bit about skin cancer, but also the third study mentioned low vitamin D. There's kind of a paradox here. We make vitamin D in our skin. That's where we naturally make it. Okay. The ultraviolet A light that causes skin cancer, plays a role, but ultraviolet B is what makes vitamin D for us. So we're really not designed to get vitamin D in our diet. And we've known for a long time that people that are deficient in vitamin D are more prone to prostate cancer, breast cancer, colon cancer. There's a lot of evidence about low vitamin D going with cancer. Wow. The darker your skin, the more sun you need to convert vitamin D. So we see more cancer in darker skinned people, especially as they move to northern latitudes. So what's a person to do? My advice on the skin cancer is to not get burned. We're designed to get a little bit of sun, and as our skin naturally slowly darkens a little bit, it actually protects us from further sunburns and from cancers. But the key is the amount. Don't get burned, and be sensible about it. And at the same time, how do you make vitamin D if you can't get in the sun? Arguably, it's more natural to make vitamin D in your skin, but I don't recommend it. Because first of all, you need to be out in the sun about half naked at noon. This is a very small solar panel. You're not going to make very much vitamin D unless you're full body, and it needs to be midday in the summertime. It's about the only time you can make vitamin D. Wow. So who practically can do that? So I recommend taking a vitamin D3 supplement. Vitamin D3 is the type we make in our skin, and it has been shown to be a better type. You really have to go to your doctor and get a blood draw to know your dose. There's no way to know other than to get a blood draw. Sure. And it takes forever for the blood levels to change. So we check the blood about every 6 to 12 months to monitor it. And so it takes me a couple years sometimes to tell people their vitamin D dose. When it comes to skin cancer, be smart. If you're out in the sun a lot, wear a good sunscreen. And along those lines, I don't recommend the chemical sunscreens. A lot of them have been linked to thyroid disruption and other problems. They don't really provide a full spectrum. The only thing I recommend, the safest thing and the best thing, are the physical sun blocks, the zinc and the titanium products. One of my favorites is one that we use in our laser clinic. It's a brand called Tizo. It's fantastic. It goes on really nice, and it's one of the ultimate for skin protection, especially use it on your face, the back of your hands, areas where we see more skin cancer.
Absolutely. Well, that's a lot of interesting info and a lot to consider, really, especially with these summer months coming up when the UV rays are really at their peak. So, Dr. Rollins, thank you again so much for that info. We'll have your full forecast coming up right after the break, and if you want to get in touch with Dr. Rollins, there's the info right there on your screen.